Hi, I'm Dr. Varudhini Kankipati and welcome to my channel. So, do any of you spend a lot of time daydreaming? Daydreaming about what could be happening tomorrow, a vacation or a promotion or even a relationship or a big event like your marriage. Things that we are daydreaming about, things that you would be feeling happy about, hopeful about, something that makes you feel really good. So we all daydream, and this is something that is universal. Everyone daydreams, they think about things. But there is something called as maladaptive daydreaming. So maladaptive daydreaming is daydreaming that is very intense and it disrupts our daily functioning. What I will talk about a little bit is you'll be like, okay, Varu, but this is everybody daydreams, right? So what does that mean? How does it become maladaptive? Well, the maladaptive daydreaming is broken up into three parts. One is the content of the daydreaming. Second is the need to go back to daydreaming. You can't stop yourself. And the third part of it is how much of that is interfering in your daily functioning and your routines. Now, maladaptive daydreaming has been coined in 2002 and it isn't recognized as a part of the DSM-5 yet, but there are clear-cut symptoms and there are clear-cut understanding of what triggers maladaptive behavior, and we'll talk a little bit about it. Maladaptive behavior is categorized with the content of the daydream, which means that we start to actually have a plot. We have characters, the characters have personalities, we have a lot of detail in that daydreaming. And I'll give an example. It's like you are a director of a movie and all the parts of that movie is you think about oh, where is this going to happen? What's the lighting? What's the mood? You might even start daydreaming about a background soundtrack for it. So it's about the intensity, and most daydreaming will not have that amount of detail to their daydreaming. But if you find that you are having a lot of details, your plots are very thought out, and there's a script, there's a dialogue into it, then definitely this is an indicator of maladaptive daydreaming. The second is that we have this compulsion to want to go back and daydream. So for example, we end up being really frustrated if someone comes and tries to get our attention and tells you, hey, you need to get back to finishing your work, and you're so frustrated that this person came and disturbed your daydream, and you have this desire to finish it off, to go back and start daydreaming again. So that's another indicator. The third one is that maladaptive daydreaming can be triggered by environmental stimuli such as noise, smell, a scene that happens, someone walking by can even stimulate this daydreaming. So it's normally triggered by an everyday event that's happening. The part that we need to also understand is why is it, or what does this talk about? The fundamental part of this is that maladaptive daydreaming means that you are escaping or disassociating with the reality. And this normally happens when one is having anxiety, stress, trauma-related events that have happened, depression. So if you look at any of the things that I have mentioned, anxiety, stress, trauma, all are very difficult and overwhelming feelings to kind of process. And what happens to us is we can't understand how to process these difficult emotions, that we want to zone out. And the best way to zone out is to daydream. So we live in our daydream and we don't want to come to the reality of the our everyday life. So another indicator for a maladaptive daydreaming is that we want to be more in the life of the daydream. Like we feel like that's a better space than to be in our everyday environment. So what happens with that is it leads to another part of it, which is that we don't sleep very well, because sometimes the daydreaming, maladaptive daydreaming, happens at night when you need to sleep, but you can't sleep because you're in this world of make-believe, or in your mind of reality, and it feels good. It feels like it's a place safe, you know what's going on, it's certain things that you like to happen, and so it's a reality world that you want to be in and don't want to live in everyday life. And what happens is that we want to spend, so this is not something that you spend 3-4 minutes, you actually spend hours together in daydreaming. And that is when we understand that it's going to come at the cost of your everyday routine. Your sleep gets affected, your work gets affected, relationships get affected, and you want to kind of just withdraw from everything here and live in this other kind of world that you have created. So, if any of these symptoms that I've been talking about resonate with some of what you're going through, then one, what do we do now? So the first one is try and understand, what are your triggers? Are you doing, or is the daydreaming happening because your work situation is too stressful, or that you had a trauma? And what I mean by trauma is you could have had a loss, you could have had a form of abuse happen, trauma related to violence, trauma related to even a natural calamity like an earthquake, or your house got burnt out, or anything, any event that was traumatic for you that has happened recently. Did you notice that your maladaptive daydreaming has increased after that? So one, we need to understand what could be the triggers. It is definitely related to your mental health, and you know that you're disassociating from it, so this would be a good indicator for you. The second is try and see if your sleep patterns are off. If you've been not sleeping well, it's disturbed, and you're more living in your daydreams, then definitely. Third is, if you're spending a lot of time in your daydreams, yes, okay? So another indicator, which is a big indicator for maladaptive daydreaming, is that when you're daydreaming, you start to realize that your facial expressions also change according to what your daydream is. So if you were daydreaming of a scene where you're immensely happy or something like that, you actually your facial expressions move along with that emotion. So you will have a smile on your face. And this is a good indicator that you are really zoned into your daydream, and that your body or your nonverbal cues are picking up on the plot or what you are daydreaming about. That's another indicator of maladaptive daydreaming. So once you know what the triggers are, you need to start understanding how do you start to bring your mind back into the reality of your situation. So what you need to do is, it's a small trick, but see if it will work for you, is when you start to daydream, try and end the daydream with an outcome that is not the worst, but it's not so desirable. When you do that multiple times, you don't really want to go back to that dream. So that's one way. Second is that if you realize you've been doing that and it hasn't worked, your sleep patterns hasn't increased, do go and consult a counselling therapist, because they will be able to direct you a little bit more and help you to make sense of what is happening and give you more precise coping skills for what has to be done. And also, you will know that is there some underlying other issue that you are ignoring, and you need to kind of pay attention to that. What you can do with maladaptive is sleep better, make sure you rest and get enough, try and work out what is stressing you, and the fourth is go seek a therapist. Okay? So I hope this gives a little bit of clarity on maladaptive daydreaming. Please don't get concerned about it, but if you realize that you are doing this, just get the right professional help, and it's something that you can help get out of and make dreaming just daydreaming, which is much more reality-based daydreaming. Okay. So thank you so much. I hope you enjoyed this video. If you did, please do like, share, and subscribe. Take care, guys. Bye.